The formula is simple but complete. Awareness, interpretation, and control. The three elements you'll need to beat high cholesterol. To build your awareness of what cholesterol and heart disease actually are, and of what the known risk factors are that can make your cholesterol level go up, let's talk to a medical professional. For the facts, we came to Pottstown, Pennsylvania to speak to Dr. Michael Popolo, chairman of the medical department at Pottstown Memorial Medical Center. To adequately understand what we're talking about, we need to eliminate confusion about cholesterol. For instance, doctor, many people equate cholesterol with fat.
Yes, they do, but that's not completely accurate because there are many other types of fats. Cholesterol is actually an organic compound from the family of alcohols. It looks and feels like soft wax and exists naturally in our bodies and in most animal fats. It's both manufactured by your body and taken in through your diet, and it's really absolutely essential to your health. But after your first year of life, your body manufactures enough to live on.
So it's an important substance to your health, but only in quantities that the body naturally manufactures.
Exactly. On one hand, if the body doesn't have enough cholesterol to form vital hormones and enable the cells of the body to function, we wouldn't be able to survive. On the other hand, take a look at this diagram. If you have too much cholesterol in your system, that excess fatty substance begins to line the arteries, leading to atherosclerosis. This buildup in the artery, called plaque, decreases the amount of blood which can get to the heart, and it can ultimately lead to a heart attack.
But people are often confused when they hear about atherosclerosis as it relates to a heart attack. So how would you explain it in terms everyone can understand?
Well, a heart attack is a blockage of a coronary artery, which basically means our vital blood supply has somehow been cut off. Atherosclerosis causes most heart attacks because as that cholesterol substance builds up the plaque in the arteries, it makes it easier for a blood clot to get stuck and cut off the blood flow. With enough plaque, eventually the arteries could completely close up and choke your blood supply.
Which may lead to bypass surgery.
That's right. If a person does not actively control his serum cholesterol level and an artery closes up enough to be potentially dangerous, then that person may need bypass surgery. Bypass surgery means a heart surgeon has to go in there and give the blood a detour. The closed artery must be bypassed by attaching a piece of another blood vessel to it to let the blood get around the clog. But even once that is completed, the patient still has a problem.
Why is that?
Just because that one clog was bypassed doesn't mean the buildup of plaque in the rest of his arteries has cleared out. It's all still there. It could be a month, a week, or shorter before some other serious events occur in those narrow passageways.
That brings up a good point, because people who already know they have high cholesterol or people who already had bypass surgery may wonder if this condition of buildup in the arteries is reversible.
All I can say is there has been no incontrovertible evidence to show that the buildup of plaque can be reversed. We can't accurately determine the extent of a person's atherosclerosis until we can perform an autopsy. So we really have no way to monitor it. Our best defense is to stop it from building up in the first place.
But isn't that goal of cholesterol reduction influenced by a person's sex, age, and heredity? I mean, those are three things a person has no control over.
Yes, well, of the 6 factors influencing serum cholesterol levels, only 3 of them can be controlled. Obviously, a person's gender can't be controlled, and it has been shown that while both at risk, men have a greater potential for heart disease than women. It's also known that certain individuals have a definite genetic propensity to high levels of serum cholesterol. What that really boils down to is this. If your father or mother had a health problem related to serum cholesterol levels, the chances are likely that you could too.
And the third is age.
Right. Aging, of course, is beyond our control, and studies have shown that as people get older, their serum cholesterol levels will go up. But rather than being related to anything medically shown about aging, it seems to be due to a lack of exercise. And exercise, as you know, is very important in controlling the amount of cholesterol in the bloodstream.
So those are the 3 factors we basically cannot control. Describe the remaining 3 factors which influence serum cholesterol levels that we can have some control over.
Well, No surprises. Lack of the right exercise, improper diet, and being overweight all increase the risk of atherosclerosis. And these factors are our own personal responsibility. Diet is obvious. As you eat cholesterol-rich foods like butter and eggs, you're increasing the amount of cholesterol that enters your body. As for exercise, well, lack of the right exercise makes it harder for your body to get rid of any excess cholesterol. So that excess may eventually find its way to the walls of your arteries. And the third factor is obesity. Some of the reasons for the higher risk due to obesity are known, while others are not. For example, we know obesity raises blood cholesterol levels, raises blood pressure, and may inhibit your ability to process cholesterol. We also know that obesity can be directly linked to poor diet and poor exercise.
At least these factors can be controlled to decrease the chances of heart disease.
Absolutely, Catherine. If a person changes those behaviors that lead to coronary heart disease, their risk factors will decrease.
The factors you can control: diet, exercise, and obesity. Hopefully now you have a good idea exactly what you're dealing with. But for 1 minute, let's review the key points. Excess cholesterol in your bloodstream leads to a buildup of plaque on the walls of your arteries. That buildup of plaque becomes what is known as atherosclerosis. Atherosclerosis can lead to a blood clot in the artery. When blood flow is clogged, you have a heart attack. The three factors that influence your cholesterol level that you cannot control are your sex, age, and family history of heart disease. The three factors that increase your cholesterol level that you can change are poor diet, lack of exercise, obesity. Now you have a solid awareness of what cholesterol is and what influences your levels. Now we want to show you how to interpret your cholesterol test results accurately. For someone to be able to interpret their status, they have to be able to look at the right numbers for comparison.
That's right, Catherine. Many people remain under the misconception that when they get their test results back, the total cholesterol count is the whole story, when, as you know, that total is just really part of a broader picture. The well-documented research of today tells us that it's the relationship between the different components of cholesterol that should be the basis of our interpretation.
The components of our cholesterol count we want to address here include the LDL, or low-density lipoproteins, and the HDL, the high-density lipoproteins. I think it's important to simplify the terms of LDL and HDL to best understand how they affect our health. And then we can discuss how these numbers can be compared to the total cholesterol count.
Well, to make it as simple as possible, HDL and LDL are both components of a person's cholesterol test results. LDL is the real culprit in coronary heart disease because LDL carries cholesterol through the blood and deposits it in the arteries with other materials, forming plaque. Obviously, then, the higher the level of LDL in the blood, the greater the risk of plaque buildup. HDL is a protective factor which carries cholesterol from the peripheral cells to the liver to be disposed of. It actually acts to reduce the amount of cholesterol that's available to the bloodstream. So the goal of that relationship is, for most patients, by keeping the LDL count low and the HDL count high, the less chance there is for plaque to form in the arteries.
And the less chance for coronary heart disease.
Exactly.
Okay. On a patient's blood test results, give us an example of how you would relate the numbers.
Well, each patient could be different depending on factors that only that person's physician can diagnose. But in general, it works like this. Suppose my total serum cholesterol level is 200 milligrams per deciliter. My HDL level is 50 milligrams per deciliter. Therefore, my ratio of total cholesterol to HDL is 4.
And that ratio puts you in the safety zone.
Right. In one study, the majority of men with coronary heart disease had a total cholesterol to HDL ratio of 6:1 or more, while the recommendation from all authorities is to keep this ratio below 4.5, which can be achieved by raising the HDL and by lowering the total cholesterol in the bloodstream.
To make it as clear as possible, describe some examples of other test results and the ratios.
Take a look at this chart to see how it's calculated. The reading I described was 200 total cholesterol to 50 HDL. That ratio was 4:1. If your cholesterol is 240 and your HDL is 40, you have a 6:1 ratio. If your total cholesterol is 210 and your HDL level is 60, then your ratio is 3.5:1, and so on.
The most important thing to realize from these comparisons is that just watching your total cholesterol level won't give you the most accurate interpretation of your status.
If a person really wants to solve a cholesterol problem, he has to do it by both lowering his total cholesterol through diet modification and by increasing his HDL level through increased exercise. Again, the goal is to keep that ratio below 4.5.
This ratio is the key to interpreting your test results. To describe what steps you need to take to keep your cholesterol at a safe level, I'll let you sit in on a session I'm about to have with a new client of mine. He's just found out from his doctor that he needs to reduce his dangerously high cholesterol level. But before he arrives, let's look at the key points of the interpretation segment to be sure it's as clear as possible. LDL carries cholesterol through the blood and deposits the excess on the artery wall as plaque. Therefore, the higher the level of LDL in the blood, the greater the risk of plaque buildup. HDL acts to reduce the amount of cholesterol left as excess in the bloodstream. The higher the HDL level, the less risk that plaque will build up in the arteries. The ratio between the total cholesterol level and the HDL will best show your status. A ratio at or above 6 needs immediate attention. A ratio at or below 4.5 is desirable. A ratio at or below 3.5 is excellent.
Unfortunately, Catherine, my status is kind of critical. Unless I change some of my habits now, I can kiss the world goodbye in a couple of years. I need your help to learn how to control my cholesterol levels.
Well, the first line of attack is changing your diet. Plain and simple, you have to reduce your cholesterol intake by changing your eating habits. This will decrease your LDL level and will decrease your total serum cholesterol count. This doesn't necessarily mean you're going on a weight loss program or a fad diet to achieve some miracle cure. Your goal here is to change your eating habits so you effectively reduce the risks of heart disease for the rest of your life.
Well, I eat pretty balanced meals most of the time, but I don't keep track of everything that crosses my lips.
Most people don't, and that can lead to trouble. As a general guideline, you want to limit your intake of all fats to 30% of your diet. And be sure that no more than 10% of your diet consists of saturated fats, which contain lots of cholesterol.
What's a saturated fat?
Saturated fats are present in foods from animal sources. Butter, bacon, fat, egg yolk. Those have a lot of saturated fats in them. Basically, to achieve a change in your levels, there are some foods you're going to have to eliminate from your diet. Some foods you should substitute for, and others of which you want to limit your portions. Today, you and I will build a list of foods that you can and can't eat, and I suggest you take note of the most specific and important ones we talk about, so you don't forget.
Well, I have my pen and paper ready, but this sounds like it means the end of the good life.
Well, it's not. There are substitutes and great alternatives for all the foods you eat. For instance, use the right margarine, and after a short time, you won't even miss butter. But I'll go through the food groups and some other categories and describe which foods are helpful and which ones you need to avoid. My goal today is to set you up with a workable diet guideline so that you'll find it easy to make healthy choices.
How long will I have to follow that? A couple of months probably, half a year?
Well, look at it this way. A healthy diet is not something that you go on. It's the way you eat. The American Heart Association recommends that to start, you should have no more than 300 milligrams of cholesterol per day, which I'm sure will be a reduction from what your daily intake is now. And if that doesn't reduce your cholesterol levels after 2 months by about 10%, that maximum daily cholesterol intake amount of 300 milligrams should be reduced by 1/3.
All right, so which foods can I eat and which foods can't I?
Well, as I said, foods that come from animals are the ones to watch out for because they are the foods that generally contain those saturated fats.
What about cheese? I know you have something to tell me about cheese.
Cheese is a dairy product, and like other dairy products, cheese has a lot of cholesterol. The general rule is limit your servings of cheese to 3 ounces. That's about 75 milligrams of cholesterol, and substitute it for a meat serving.
That hurts. That's pizza, that's cheeseburgers, that's cheese melts, that's blue cheese salad dressing.
That's also a step toward increasing the length of your life. Look, Ray, there are going to be times when you eat cheese or you use butter on your toast. If the majority of your diet stays in line with the 300 milligrams of cholesterol per day, you will be all right if you let yourself go a couple of times a month. It's bound to happen. The point is, the majority of your diet has to be balanced, and your cholesterol level has to be controlled by changing the things you eat.
You're right. And that's why I'm here. How about salad dressings? I just lost my blue cheese. What can I substitute that with?
Choose Italian or French dressings that are not creamy. If you want to reduce total fat in your diet, switch to reduced calorie versions.
Well,
Vegetable food group is going to be your best friend. Stick with limiting your cholesterol intake to 300 milligrams a day for 4 weeks. Get another test, and we'll take a look at your numbers again then.
sounds good. Thanks a lot, Catherine.
When you're cooking at home, you have complete control of the cholesterol content of your foods. Remember to use only polyunsaturated vegetable oils made from safflower, sunflower, corn, partially hydrogenated soybean oil, or cottonseed oil. Choose a margarine made from these oils for cholesterol reduction, and replace whole milk with low-fat or skim milk products. Bob didn't get the chance to choose between butter and margarine. Most restaurants make both available if you ask. If margarine is not provided, eat your bread without the butter. And then came the flounder. While Bob made a great judgment avoiding anything that is deep fried and fat, he missed an important point. Here's what he got. Flounder which was breaded in a mixture of raw egg and breadcrumbs. The cholesterol is still there in his meal. When you're stuck with a difficult menu, look first for chicken or fish which is broiled and has no added butter or sauce. A 3-ounce portion of lean beef may be your best bet, but skip the sauce and the gravy. It's not an easy task avoiding cholesterol in what someone else prepares, but you should still do your best to be aware and cautious about what goes into your mouth. Find out how foods are prepared and what kind of sauces top entrees. You pay for the food, so put your foot down and take your time ordering. In time, you'll find a few places that make it extremely easy to order without a lot of effort. It just takes some patience. This is vital information. Here's a short review of the main topics we've just covered about diet and cholesterol. The first line of attack to reduce cholesterol levels is by controlling your cholesterol intake. Limit the intake of all fats to 30% of your daily diet. Limit intake of high cholesterol or saturated fats to 10% of your diet. In general, foods from animals are high in cholesterol. Foods from vegetables, fruits, and nuts are generally low in cholesterol and fat. Ounce for ounce, fish and poultry have the same amount of cholesterol as red meat. Avoid organ meats like liver. Be sure all the meat you do eat is lean. Control your serving sizes to 3-ounce portions. Eliminate deep-fried foods from your diet. Eliminate completely or find a substitute for real eggs. Substitute for whole milk with products with 1% milk fat or skim milk products. Substitute margarine for butter. Safflower, sunflower, corn oil, partially hydrogenated soybean oil, and cottonseed oil are best substitutes for butter and cooking oils made with saturated fats. Become a label reader when you shop and be completely aware of what you're eating. This diet change must be a permanent one to reduce your risks of heart disease. The second stage of controlling your cholesterol level that your doctor will advise is by increasing the amount of aerobic exercise you get. As we learned before, reducing your overall cholesterol level is a function of lowering the amount of LDL through dietary change and by increasing the amount of HDL. Certain types of exercise have been shown to increase the HDL level significantly. In fact, hiya, Denny. How's one of my favorite patients?
Good, Catherine. How are you?
I'm just fine. I was just talking about reducing the risk factors of heart disease. You were diagnosed at high risk 6 months ago, right?
Yeah, I had changed my diet for 2 months to bring my level down, but I was still in the danger zone. So my doctor had me increase my level of exercise.
And what exercises did you use?
Under my doctor's advice, I stopped my weight training and basically tripled my amount of long-distance exercising.
By long distance, I assume you mean aerobic.
Yeah, my doctor basically said that my golfing, my bowling, and weight training wouldn't exercise my heart and lungs enough to achieve the level of growth I needed. So she suggested jogging and biking and swimming as the most beneficial workouts.
Have they worked?
Well, as of my last count, I dropped my overall reading from a 260 to a 210 in only 6 months. But even more impressive, I've raised my HDL level from 40 to 50 time period.
Now that's progress. You must really have stuck to it. That would bring your HDL to total cholesterol ratio to under 4, which is excellent.
And the program I've been following is I start with 5 minutes of stretching and some calisthenics to warm up. And then I either jog or swim for 20 minutes straight to reach and maintain a heart rate of 110 beats a minute. Then I cool down for 5 minutes by walking or treading water. In all, it takes me about a half hour a day. That's a pretty good session.
Good for you, Denny. Now, when you started, did you have any problems with injuries?
Not really. A warm-up session prevents most of those problems. And I knew I wasn't going for the gold medal right away. I mean, I've never been a good athlete. It took me a good month before my level of exercise got to the level it is today. But my doctor helped me set a good pace to start.
Sounds like you're doing great. Well, don't let me hold you up anymore. Have a good workout.
Thanks. I'll see you, Catherine.
Denny has some remarkable results in just a short time. You may too if you work up to a sound program and follow the guidance of your physician or a qualified trainer. Your objective will be to raise your heart rate over 60 to 75% of your heart's maximum rate for 20 minutes, at least 3 times a week. This chart shows general guidelines to find your target zone. Look for the age category closest to yours. If you're 30, your target zone during exercise is 114 to 142 beats per minute. If you are 50, 102 to 127 beats per minute is your general target. To check your heart rate and see if you are within your target zone, you should take your pulse right after you stop exercising. Place the tips of your first 2 fingers lightly over one of the vessels of your neck to the left or right of your Adam's apple. Another convenient spot is on your wrist, just below the base of your thumb. Count your pulse for 10 seconds and multiply by 6 to get your beats per minute. If your pulse is below your target zone, exercise a little harder next time. If you're above your target zone, exercise a little easier until you find that you are exercising within your target zone. Don't start any fitness program without your physician's okay, because these target zones and guidelines are general and can't take your specific situation into account. When you get your next cholesterol test results, ask your doctor about your exercise needs. If you can stick to that program using aerobic dancing, swimming, running, cross-country skiing, or jogging, for instance, you will not only increase your HDL level, but help to control your weight and increase your overall fitness as well. In fact, statistics show that if you burn 2,000 calories a week in exercise, you can lower your chances of heart disease by 65%. At least every little bit helps. You've probably heard it a million times. But now it's time to do it. Here's a review of the main points of exercising. I'll see you back in the office. Permanent diet change is the first line of attack to reduce your risk of heart disease. Exercise is the next line of attack. Aerobic exercise is the most beneficial for raising your HDL level. Aerobic exercises include aerobic dancing, jogging, swimming, bicycling, fast walking, cross-country skiing, and rowing, among others. Your objective will be to raise your heart rate over 60 to 75% of your heart's maximum rate for 20 minutes, at least 3 times a week. Consult your doctor before starting any exercise program. For some people, diet modification and exercise won't be enough to reduce their chances of heart disease. But with the assistance of modern medicine, there's a third line of defense which is available by prescription. Prescription drugs are not an alternative unless diet and exercise have proven ineffective for an individual. But in those cases, drugs that help reduce cholesterol can save the lives of people who have exhausted all other possibilities. Your next step is important. Go to your doctor to get a blood test of your serum cholesterol levels and start making the changes necessary to reduce your risks of heart disease today. It's a lifelong process, but if you catch it in time, you really can beat high cholesterol.